Hello, in this video, I am going to go over chapters 5, 6, 7, and 8. Kind of tell you what I want you to know from them. As I probably have sent out emails earlier, y'all please keep up with your homework, keep up with what we're doing because it's the same problems you're going to see on your final. Okay, so just kind of keep a binder. If you're still struggling, the way you're going to learn math, as I probably have said earlier, is to work problems over and over and over. That's how you learn it. You can't just do a problem one time if you're struggling with it and expect to have it. So it's going to take a little work on your part if you're struggling. So just know that. And like I said earlier, call me. Let's talk. I can spend time with you on the phone, work problems with you on the phone, and hopefully get you to where you understand where you are. Okay, chapter 5. Chapter 5 is, of course, in our trusty book, so I do believe in the book. I think the book is good. I do think that we've kind of condensed it down. So please just follow along. We're going to start with um, measurements, medication administration. We start with measurements and equivalents. Um, if we turn to page 72, there is some things on table 5.1. Some of the common things that we'll see in medicine. I mean, we'll see some in medicine, not centimeters so much, but we will be using that in this course. We will see milligrams a lot. We will see grams a lot. We will see kilograms a lot. We will see milliliters a lot. And liters. So those are some abbreviations you need to be familiar with. And where else will these abbreviations be? On your little conversion sheet. So keep that really, really handy. Okay. Um, So as we go through, you just have to practice some little things on page 78. Go through and be sure that you practice over that. Approximate on page 74, table 5.4. This is approximate household metric weight and equivalence, which we don't do metric as much. Medicine, we will get a little more into that. But pretty much everything that you need to know is on the sheet. So keep this sheet. This is the sheet you need for this course, okay? So be sure you keep this sheet. Um, so be sure that you know how to write it correctly. The abbreviations, that is the main thing. Um, you need to know pretty much as the sheet tells you, keep it in front of you. We will have problems that say 1 cup is 240 milliliters, 1 gallon is 4 quarts. Let's see here, 1 liter, 1,000 milliliters. We will use that one a lot. So if you have a problem looking for a half a liter, what's a half a liter? 500 milliliters. So just kind of get those in your head. So all this 1 milligram is to 1,000 micrograms, 1 gram to 1,000 milligrams, 1 kilogram to 1,000 grams. All those you need to be familiar with. Okay, so just keep this little sheet in front of you and it will always help you. So let's look at our chapter 5 homework. That's pretty much what I want to say from that chapter. It's short and sweet. Our homework. Um, let's take, let me see. Number 1, y'all too, and I've said this earlier, but I'll say it again. If you're having trouble, print these out. Print them out and have them in front of you when we go over it. I think it will help you. Be sure that you take notes. Chapter 5, measures and equivalents. And if you need to print, you don't have printer access at home, colleges open 9 to 3, all campuses, Monday through Thursday. The computer labs are open, so you can print. Okay, so if you're having trouble with the internet, that's a good place to go too. Let's take the first one. We're looking for measurements and equivalents. So it says 100 milligrams is equal to how many grams? So I'm going to work this with you and we're going to talk through a few things. So we're looking, number 1, let me get a little trusty pen here. Number 1, 100 milligrams is equal to how many grams? Work this along with me. That little g is grams, okay? So work that along as we go. The first sentence is what we're going to solve for. So the first thing that we are going to solve for, we are looking for grams. So we are going to go back to your conversion, and we are looking for the conversion that would convert grams to milligrams. Do you see this 1 gram to 1,000 milligrams? That's what we're going to use. So we're going to start with the conversion, 1 gram to 1,000 milligrams. And then we're going to multiply that times, if we got milligrams on the bottom, remember, same thing. So we got our conversion because we're looking for, let me rewrite this. Hang on a minute. I wrote this wrong. 100 milligrams equals how many grams? We use our conversion, 1 gram to 1,000 milligrams. So we started with our conversion, and where did I get that? Off the conversion sheet, because we're looking for grams. So we know where we're dealing with grams and milligrams. So we're writing right here, 1 gram to 1,000 milligrams first. So then what does dimensional analysis tell us? Then we have to go up here with what? What are we going to have to go up here with? Milligrams. So what in our problem do we see milligrams? We see in our problem 100 milligrams, right? So we're going to write 100 right here. 100 milligrams. And then what do? We're going to multiply this all the way out. And it's going to give us 100 over 1,000 milligrams. Or the milligrams going to be crossed out. So we're going to have 100 grams. But we're still going to need to divide that. So it's going to give us 0.1 grams. So how did I get 0.1? Who knows? Huh? You divide 1,000 into 100, right? And it's going to give you 0.1. Everybody with me? All right. Let's look down to number 9. I wish I was in class with y'all because I would ask you who does cooking. So we are going to look at number 9. We are looking for 2 tablespoons. 2 tablespoons equals how many milliliters? So what did I tell you first? This is number 9. 2 tablespoons equals how many milliliters? So we are looking for milliliters. So what is going to go first on this line? Milliliters, right? Milliliters. So let's look on our little sheet right here. Do you see right here, number 2, it says 1 tablespoon to 15 milliliters because we're dealing with tablespoons and milliliters. So our trusty little conversion says 15 mLs to 1 tablespoon. And then what are we going to put up here? Tablespoon right there. So, and then we have 2 tablespoons in our problem. So we're going to put 2. So 15 times 2 is what? 30. So our answer is going to be 30 mLs. Our answer would be 30 mLs. Okay. All right. So see about working those. Just work them in the same fashion that I did. If you have any trouble, pick up the phone and text me, and let's go over that. Okay. All right. Let's move to chapter 6. Chapter 6. We're rolling here. It's conversions. Conversions with the metric system. Conversions with the metric system. Let me find my paperwork, y'all. I got paperwork everywhere. This is not how I prefer to teach this, but this is how we're going to do it. So, it's pretty much the same thing. We're just converting it with the metric system. So, do we have metric on our little sheet? We sure do. So, this just kind of gives you a picture when you start out with chapter 6, conversions with the metric system. It kind of shows you that to start with 1 microgram, how small a microgram is, it's would be 1 milligram. And your conversion is on here, 1 milligram to 1. So, I mean, 1 milligram equals 1,000 micrograms. So micrograms is a very small unit, and then milligrams, and then we have grams, and then we have kilograms. Okay, so that just kind of shows you a conversion, just kind of in picture, but you have all those conversions right here. All right, so kind of read through that. So let's do a little bit of converting. Let's just take our homework again. I'm not going to read through that. I think that y'all can work some of these problems. I mean, if y'all want to work a problem, just look at these. These are worked out really, really well in the book. If you're struggling, there is some extra practice on page 83, and the answers will be on page 90. And of course, when you turn to page 90, they are worked out for you. They don't just leave you high and dry. So just look at those, but it's all pretty much the same type of stuff as we just did. So I think our number one, we're just going to use a different system, but it's all the same thing we want to use. Let me just find number 6. Our first homework problem is, let me just see right here. Let me get a sheet of paper. So number 6, this would be, let's do number 2. Does that look kind of scary? So number 2, we have, what is it? 276 micrograms to how many grams? Okay. So where on your conversion do you see micrograms and grams? I see 1 gram is equal to 1 million micrograms. Right here, y'all see that? The very last one right there? That's what I see. So that's what we're going to have to use to work this problem. So what did I say first? We would always put on top what we're looking for. So what are we looking for? We're looking for grams. So it'll be 1 gram to, and then we put this over 1 million micrograms. And then this is how you would write that. Write that. And then what's going to go on the top right here? Micrograms. Right there. 276. 276 micrograms. So then what are we going to do? We're going to scratch out the micrograms. Microgram gone. So we just are solving for grams, and that's what we need for our problem. So once you multiply all this back out, you're going to get, the answer would be 0.000276 grams. So multiply that all out, and that's what you're going to get for that. Okay, 0.000276 grams. Okay, so if you struggle with that a little bit, what I want you to do is cover this problem up, think about it, come back and work it and see if you can do it. Okay, be sure that you divide it all out right. See where I put my decimal in front of that. Be sure that you do that. Okay. Alrighty, let's do one more. Let's do number 9. If you look at number 9, we do use this an awful lot, this pounds to kilograms and work in drug problems. So this is number 9 on our homework. It's 154 pounds equals how many kilograms? So where on our trusty conversion do you see kilograms and pounds? I see kilograms and pounds right here. 1 kilogram to 2.2 pounds. So we're looking for kilograms. So we know if we're looking for kilograms, what has to go on top? Kilograms, right? So 1 kilogram to 2.2 pounds. That's how I would start it, right there. Then we're going to multiply times what? On top right here. What do we have right here in this problem? If we go to pounds, if we're at pounds here, we have to go to pounds here, right? Pound, pound. Okay, so we put 154 pounds. And so we're going to X out the pounds, and we're going to be left for kilograms. So after you multiply that all out, your answer is going to be 70. All righty? Everybody with me? So it would be 154 divided by 2.2 pounds. Okay? And you're going to get 70 what? 70 kilograms. Okay? Everybody got it? Okay. If too, when y'all turn in homework to me, if y'all will turn in your work, I will look at it and see what I can do. That if you're making some errors, just be sure that any of these, whenever you're looking, whatever you're looking for, is going to go on top. That's how you know to start it. Always, that's the when you're looking for grams, grams goes on top. That helps you start. Okay, so just keep that in mind with when you are starting these problems. All right, there is. A thing under your activities on rounding, leading zeros, and trailing zeros. I need y'all all to read that and kind of sign it or just send me an email that you have read it, and I will give you your point credit for that. In nursing, you have to be very, very careful about like not having, be sure your decimal's in the right place and be sure that you don't leave, say, if you have, it's supposed to be 0.50, that's what you come up with. Well, I wrote that on 0.50. If you don't put a zero in front of this, 0.5, and you don't really need this zero, so 0.5 would be, say if you come out with that's your answer. But if you were to leave it, say like this, and with no zero and maybe just a little point, could that be misconstrued for something? So if we look at this, this would be a half of something. This would be 5. It could be like we're supposed to give a half a tablet. This looks like 5 tablets. There's a big difference. So that's why we need to be sure we understand the round numbers. Be sure that you read that sheet. You send me an email that you have read it, okay? And that will help you and then work in medical problems. And that's very important when we are dealing with people and their lives, okay? So that's why we're kind of strict, a little more strict in this. And of course, it can make difference like in money and everything else if you don't pay attention to that. All right, y'all. Really, 5 and 6 are pretty much the same chapters. Just read through them, work that little kid homework. I worked a couple for you on each homework slide. Um, let's move into number 7, chapter 7. It's calculating dosage safely using a dimensional analysis approach. Um, what are medication eras? That's where we kind of have to start thinking because y'all are going to, a lot of y'all are going into healthcare. So we want to be sure that we're very safe with medication. A medication era is any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in control of the healthcare professional, patient, or consumer. So medication errors happen. We are human, but we need to do everything humanly possible. Try to not do them. So there's a lot of things in healthcare that we could do. Maybe a lot of time medication errors happen when you're in a hurry. They happen whenever you're not really following all the rights of medication. We're going to talk about that. You haven't checked your order. You haven't made sure it's the right patient. They put all these things in place, constantly putting things in place to try to help with medication errors. However, humans still make errors, but let's just see what we can do not to make errors. Our book and the PowerPoint is on 7. It says every year 7,000 Americans die from medication errors. Ugh, that's a lot of folks. Do you want to be part of the healthcare system that causes somebody to die? There is a very big case right now going on out of Vanderbilt about a nurse. If you probably just Google Vanderbilt CMS case, Radonda Balt is her name. It's pretty scary. You know, Vanderbilt's a big place, and it's just happened a couple of years ago. But she's up against criminal charges for what she did. So just know that, you know, healthcare, you know, you think right now you're brand new, you're green, you're not going to do this, but just know you get busy, you get super, super busy, super stressed. But there's just certain things you always have to know is that medicine is very, very important. And that's why we make a big deal about this in math, because a math error will kill a patient in a minute. So you have to be very, very careful with that. Okay, let's look at chapter 7 a little bit more. Um, Pretty much chapter 7. I want you to kind of read through it. Have your book open when you take the test, because there will definitely be some things that you need to know. Uh, you know, just know about medication errors. It talks about the Joint Commission. The Joint Commission is somebody, this is on page 95, that kind of monitors medication and monitors hospital. It goes on, um, as we go through this, they'll talk about package dosing and all the things that they have put in place. If you turn to page 97, single dose files. So no matter if you don't, like, say, look at that furosemide, which is Lasix, which we give a lot of in the hospitals and stuff. If you don't give it all, it doesn't matter. You throw it away. It's a single dose file. Some of that has cut down on some medication errors. Um, like the epinephrine, it shows you it's a multi-use file. They don't have this much in the hospitals anymore, so they're trying to kind of do away with that. Pills that come in a separate little blister pack sometimes really, really help. So just read through that. Um, There's something called automatic medication dispensing systems. That's kind of, we refer to them more like a Pyxis, and you see the nurse on page 98 punching in from the Pyxis. However, in these Pyxis, you can't override, and that's what Rodonda Vault is her name from the Vanderbilt case. She overrode the Pyxis and got something that was detrimental and did kill a patient. So it's not a foolproof system. It does help. It helps greatly, but it still can be um, have something that you can make an error. Now, down in the yellow box, page 99, this would kind of be like the nursing creed or whatever. The 6 rights and 3 checks of medication administration. You have to know this. You have to know this now. You need to know this from this day forward. When you go to nursing school, they're going to be asking you this probably every time you give medicine for it. And you should really go through these every time you go through give medicine. The 6 rights ensure that the rights are being followed when preparing drug for administration. The right patient. You don't know some of these patients. So a lot of you in the rural area will go and work in rural healthcare, which could be like a nursing home, and you might be responsible for 30 patients. Okay, these little people don't always wear a name band, or they don't have a name band. You have to get to know them. Just be sure that you have the right patient. Even in the hospital, these people come and go pretty fast. You may not know them in the hospital either. So just be sure that you always have the right patient, the right drug. Okay, that's where Pyxis and automatic dispensing things have come into play that have helped greatly. Um, the right drug, that's what I just said about that. The automatic dispensing will help with that. But it's like I said, Rodonda Vault, she overrode and got a fatal drug out and gave to her patient. Well, it's fatal in the fact that the patient was not intubated. Okay. The right dose, you always need to make sure you're given the right dose, and that's where your calculations a lot of times will come into play. Even if the pharmacy sends something up to you and says, give this medicine and this quantity, you still are responsible. You are the nurse to double check that. Okay. The right route, or route or route, however you want to say it. That means by mouth. That means sublingual, which kind of means under the tongue. You can give sub-Q medication, which is just a little short shot, I guess you would say. You can give it IM. You can give it in a suppository. You can give it IV. We're going to go through all that. So there's lots of ways that you can give medication. Some medication you can give it in the ears, you can give it in the eyes. Certain medications are only made to give a certain way. So you have to make sure that you're doing that correctly too. Right documentation. You always want to document what you did. Okay. So the 3 checks. When collecting the medication, there's a check. Prior to entering the patient's room, there's a check. And at the patient's bedside. Okay. If for some reason a patient is looking at a little med cup, it's like, oh, I don't take that little orange pill. what are you going to do? You need to turn yourself around or recheck, because even though you may think the patient may not know what they're talking about, always double check that, okay? Because that might have been a cue that that was not a pill for your patient. All right. You'll be hearing much, much, much more about this as you go through nursing school too. Um, so we went through the six rights. On the right patient, when you're trying to identify the right patient, there's certain identifiers: name, date of birth, social security number, address, medical record number, and facility account number are all acceptable identifiers. Room numbers or bed numbers are not acceptable patient identifiers. They're just not. You can't use that. So just be sure that you read through what's right during the PowerPoint I'm kind of referring to is that Chapter 7 PowerPoint. It is pretty good. Um, on down, when we talk about the right dose, administering the wrong dose of medication is also a common type of medication error. Factors that contribute toward dosage errors include poor handwriting. Now, in the days of computers and stuff and how we're going to all computer charting, that has helped greatly. However, back in the day when I started nursing in 1983, whoo, that doctor's writing was terrible, and you had to decipher, and these little, it could be like give 0.1 milligram of a medicine, but the way they wrote it, it would be easier to give the whole one. So you're giving 9/10 too much medicine, if you don't really know how they're writing it and you don't clarify that. Um, Inaccurate calculation of dosage, incorrect transcription of the dosage from order onto the medical record. And this can happen. That's why you have to look at those orders, because even though you think in days of computers this will not happen, guess what? It will happen. Pharmacy may put the order on your medication sheet, but who is ultimately responsible to make sure that's correct? Look at yourself in the mirror if you're going to be a nurse, because it's you. Okay. Um, Use of trailing zeros in a dosage prescription. You don't ever use trailing zeros, and that's what I want y'all to review that sheet that's on your activity sheet and sign that you read that sheet and you understand it, and keep that sheet, because you will be counted wrong on problems if you do that. Um, so those are some things. Also, drugs can also sound alike. There's a lot of drugs that or like if you're taking a verbal order, be sure that you know which drug the doctor wants, because a lot of drugs are very close in name, that you know what the drug's given for. And then you need to know what the right dosage amount is. So always question a dose of medicine. If you have calculated and you've looked at it and you look it up, if it's outside the dosage range for the patient, then you need to question that, because if it's too much medication, or even say if it's not enough medication, sometimes it will not be effective for the patient. Right route, we talked about some routes, and this is only coming from the PowerPoint. It's in your book too. Um, we talked about enteral, which is oral, rectal, or through a tube placed in the stomach or intestine. That's enteral medicine. Buccal is in the cheek or sublingual under the tongue. Parenteral is injected into the tissue or into a vein. So parenteral can be an IV medication or a shot, an IM injection. Topical is applied to the skin. Vaginally, I don't have to explain that anymore. Inhaled. Inhale would be like a breathing treatment. If you have ever seen anybody take a breathing treatment, that is a medication. Um, Intrathecal, which is an epidural or a spinal via injection, and they use a lot in labor delivery and surgery. Okay. Um, so be sure you know the right time. That is what this sheet will go over right here. Is we have abbreviations in the book that we're going to go through. Homework, safety consideration, and medication administration. Uh, Shows you how to write orders and all that kind of stuff. We don't have to know all of that, but on page 108 and 109, that's where your homework's going to come from, because you're just going to have to look at what is NKDA stand for. NKDA stands for, and if you look on your sheet and find NKDA, no known drug allergies. So just be sure you do your homework sheet for this lesson. It's right here. And um, It's kind of a matching exercise, and you will be able to do that, and that'll help you with your abbreviations. Also, while you're taking any further tests from now on, have this abbreviation sheet handy. That way, you'll kind of remember what abbreviation it's talking about if you're not real familiar with it. Okay, so that's pretty much chapter 7 in a nutshell. It's just a lot. You don't have to be worried about anything about that MAR or writing out medications. Medication, like on page 106, to show you how some orders and was this right, blah, blah, blah. Just read over that. You're not going to be like really expected to know just a ton about that, but just be kind of familiar. Um, And if you have any questions on that, be sure you shoot me a text or an email, or either, call me or something, and let's talk about that. All right. One more chapter, chapter 8. And guess what? No homework for chapter 8. Let me see here. What did I need to go over? I had something just to go over with y'all. Alrighty, let's just go through chapter 8 and kind of tell you things to review that are on your test, okay? So it's prescriptions and medication orders. The glossary, DEA, Drug Enforcement Agency. We all probably should know that. That's a common term we hear a lot. Prescription authority. What does that mean? Who has authority to write prescriptions? Telephone orders, providers order that are received over the telephone. Transcribe is transcription, to transfer information from one source to another. Verbal orders is a provider order that is received in person, or over the telephone. We, as hospital, we used to do a lot of verbal orders and stuff. We really have gotten away from that. Verbal orders may be in emergent situations, like if you're in a code or something like that. But if a doctor's standing right there and gives you a verbal order, have him sign off on it. Okay. Just know that verbal orders are not the best way to go. But if you're in a code situation and everybody's working really, really feverishly trying to save somebody's life, you may get some verbal orders. But be sure that you repeat it back and be sure that you know what the doctor has said. Because, like, when they're like stressed or something is really, really going on, they may say something and it'd be pretty fast. What does a prescription include? This is on 117. It's 117. The first little orange dots, there's 5 little orange dots, 1, 2, 3, 4, 5. Be sure that you know that. You'll have a test question on that, okay? The date of birth, information about the patient, name, address, date of birth. That's the patient's date of birth, not the provider. Who is the provider? The doctor, the nurse practitioner, or whoever that's writing the prescription. Review, box 8-1, who can write prescriptions? On down, it says prescribing narcotic drugs to patients requires that the provider be registered with the Federal Drug Enforcement Administration, who is the DEA, and appropriate state agency. So if you're going to write narcotics, you have to go through those agencies and be sure that you're above board. Components of handwritten medication orders. If you look through this, in that you can either write the trade name or the generic name. We all should be kind of familiar with that. Tylenol is the trade name, acetaminophen is the generic name, that kind of thing that we see a lot. Most doctors now use a lot of generic. When I first started nursing, generic kind of had come about, and the doctors wouldn't hardly use them because they said that, it wasn't as good, yada, yada, yada. But back in those days, all the doctors had their money in certain drug companies, and so they wanted us just to use those drugs. Go figure that one. So there was a lot of that. But since there's been a lot of legislation and stuff come down, that doctors can't do that too much anymore. So that kind of put a stop to some of that. But probably some of it still goes on, truth be known. So be sure you read through the components of handwritten medication order. You'll see a test question from that. Mainly is it trade name or generic can be wrote. So just kind of underline that. That's under 118, name of medication. Some types of medication orders understand these terms that are under special types of medication orders. 119, one time only. What does one time only mean? One time only means one time only. Stat. We all know what stat is. We watch Grey's Anatomy or whatever. What's stat? Hurry up, do it now. It has to be done now. Okay. Um, Standing order. A standing order is like usually a file of orders that you would have for certain classifications of patients. You see standing orders from a lot of physicians, and their admit orders they're not really supposed to use. They're supposed to tweak those because every patient's supposed to be different. You'll see standing orders a lot in labor and delivery units. So those standing orders, be sure you read about standing orders. Um, let me see. Um, Safety considerations in ordering and transcribing medication, receiving verbal orders. Verbal orders are those given by the provider in a face to face situation or over the telephone. Verbal orders carry an inherent danger of drug error and should be used only in urgent situations. Okay, so just be sure that if that patient, I mean, if he's standing right there or she's standing right there and gives you an order, then they can sign off on that order, okay? Now, there might be a situation where they're actually saving life and they can't, but they need to as soon as possible. Illegible and incomplete orders. Handwritten medication orders must be legible and complete. The order should be printed, not written in cursive. Because why? Because they scribble in cursive. And should contain all necessary components. Illegible and incomplete medication orders can easily lead to errors. Wrong medication, wrong dose, wrong time, wrong route. Only approved abbreviations should be used when writing medication orders, and even then, abbreviations should be used sparingly. If an order is illegible or incomplete, the nurse or pharmacist must call the provider to clarify the order. You have to do that before you give it. No ifs, ands, and buts about it, okay? The do's and don'ts of taking verbal orders. Read back the order under the do. Read back the order in its entirety. Include documentation in the order that signifies the order has been read back to the provider. So the doctor's calling you in with a verbal order or telling you a verbal order or a telephone order, and then you write the order, and then you read back. Be sure that's to know that you read it back and they agreed that what you said was correct. Okay, just a little step, but it still can get into he says, she says. I know like working all nurses, especially if they start in specialty units, they're going to work some nights. These doctors are asleep, they're not awake. Be sure that you're getting the proper order from them when you call them. I know working in the NICU like I did, there was an older doctor, loved her dearly, but in the middle of the night she'd be tired because maybe we'd had a really rough day and we'll call out and I said, look, sit up on the side of the bed and talk to me a minute. You have to kind of like you'll know that some of them that you can kind of because they'll just mumble stuff to you, you can't begin to understand what they're saying. Um, so um, and then on down, just be sure that you know the dues of taking verbal orders. Um, if a provider gives you a verbal order in the hallway, accept it, but ask him to write the order in the patient's medical record before leaving. Okay, so you need to get some kind of clarification on that anyway. Um, be sure that you know about readback orders. Um, Medication administration record on page 123. The medication administration record um, is used to document medications administered to a patient after provider writes a medication order. It is transcribed to called a MAR. MAR stands for Medication Administration Record by either the unit secretary or the nurse. The nurse then double checks that order, which was transcribed to the MAR, accurately and cosigns in the original order. A copy of the order is sent to the pharmacy where it is processed and filled. But ultimately, y'all, like I've said before, nurse is responsible. The nurse, you, me, we're responsible. Okay. Yes, all these other people can make an error, but who does it come down to? It stops with us, the nurses. Back on page 122, review box 82, example of lookalike sound-alike medications. Documented administered medications 124. In nursing, if you don't document it, you didn't do it. Okay, just plain and simple. You don't document, you didn't do it. No matter if you did do it, but if you don't document it in the eyes of nursing, you did not do it. Okay, so be sure you document. Be sure on the MAR that the nurse that you signed who it was, the time medication given, and the route. Okay, you have to put all that on there. and read under the MAR. The MAR is a legal document and part of the medication record. Okay, so it is a legal document that can be used in a court of law against you. Okay, so be sure that you do that correct. One thing that nurses are bad about doing, and I see this over and over and over, say you're working a floor and you're very familiar with these patients, and so you might, this is on 125, initial everything. But then you have the pills and you haven't gone in there yet. And a lot of our systems now that are in place, you cannot do this anymore. But still, there may be some older systems out there that you can. But it says do not, this is on 125, initial MR before the medication is administered. If the medication was not administered at the prescribed time, perhaps because the patient was vomiting or having a CAT scan, then the nurse should follow the institution policy for documenting held medication. Most facilities also require a note in the patient's chart about the reason for holding medication. Your facility will have different reasons with different ways that you need to follow the procedures, but usually you do have to chart patient was at CT, medication withheld, whatever. Just say, or patient was too sick, or patient refused, whatever it is, you have to chart it, okay? Let me see what else in this book that I want to kind of go over in 8. Be sure that you know how to, that the way orders should look correctly. And that goes back, they'll write, let me see, on transcribing orders and be sure that you have a DEA number on there. Um, just go through this test, have your book in front of you, and I think you will do great. Um, on this test, so just look at it. I'm going to give y'all probably a little more time on this one. Um, you have to know on an order what the medication is, what the route is, how often it is to be given, um, and what it's given for. Okay, so if you had an order of Tylenol PO every 12 hours, you can't take that order because PO every 12 hours, what are you giving Tylenol for? You have to know what it's given for. Aspirin, 325 milligrams every 6 hours, PRN fever. Okay, that seems like you could probably use that, but it doesn't say how high the fever should be. Heparin, 5,000 units sub-Q twice daily. You could do that one, okay? Um, so, because it gives you heparin, 5,000 units sub-Q twice daily. That would be a legal order. But the aspirin, 325 milligrams every 6 hours, PRN fever. There's a lot of people that say fever is now 999, fever is 100.4, fever for a baby might be 99.6. Who knows what the fever? So you have to have parameters for the fever with the doctor, where the doctor wants you to give that medicine. So there's a lot of things to that. Key points are 128. Be sure you go over those key points. Like I said, there's no homework for this chapter. You will get your points. Just do your test and you'll get your points. All righty. So I will be back to go over the next chapters with y'all. Just be sure that you're keeping up. Don't get behind, y'all. That is the main thing. Do not get behind.